Thank you very much for the opportunity. Good morning, everyone. It is our honor to co-present the experiences of the Afro-GIS Center in terms of the use of innovative solutions to support polio eradication and other health interventions in the WHO African region. So my co-presenter is Babona Nshuti, a colleague working with us at the Afro-GIS Center. The Afro-GIS Center was put in place by the WHO Regional Office for Africa, of course, based on the need for us to organize at the regional level efforts to strengthen the utilization of innovative solutions to support polio eradication in our region. And based on this, the center was established with funding from the Bill and Melinda Gates Foundation and inaugurated by our regional director, Dr. Matshidiso Moeti, in February 2017. Of course, our mission, as you see, is aligned to the global mission of WHO, but specifically for us, we are supporting the effective application of GIS and mobile health solutions in terms of providing timely, corroborated, and reliable geospatial information products, of course, to support polio certification efforts, health emergencies, as you would see, as well as other public health initiatives. And that's why we are happy to participate in this important symposium, noting that the use of GIS cuts across all the different domains, even beyond health. And as most of you would be aware, that GIS as an innovative solution provides ideal platforms for the convergence of disease-specific information and their relationship in terms of analyzing social and health services and the natural environment. And as such, the platform provides ideal, timely, location-specific data for us to monitor disease surveillance, as well as other health initiatives in our region. So we will take you through some of the key areas that we've supported. Of course, it will be difficult for us to tell you in more detail about all the work that the GIS Center has been doing over years. However, we'll do our best within the time allocated to take you through some of the key areas that could be linked to the HPV program, so that you will see how best we could leverage some of these solutions. First is mapping baseline. As most of you would agree with us, almost everything happens in time and space. And in most cases, when we analyze data outside of the spatial context, what happens where, we may just be dealing with half of the story. And I think for us, putting in place baseline data in terms of where are the administrative areas, where are the health facilities, the points of interest. When it comes to certain interventions, we want to know where the schools are concentrated. So this information is very important for us to use alongside any solutions that we are going to develop, as you will see. Microplanning is also key to the work that we do for polio, because we needed to know which settlements should be covered. How many under 5 children are in these settlements, and we need to also monitor in terms of the coverage. So for us at the GIS Center, we also provide that mechanism for the program to be able to do planning effectively. You will see some of these examples. Providing also a mechanism for estimating population is key in this regard. So we have solutions that will give us an opportunity to rapidly estimate population. We are not saying these are official census data, but at least it can provide us with operational information as to the estimate of the number of people living in a certain geographic area. Real-time time tracking of vaccination activities is also critical to know that where you are deploying vaccinators, whether they are reaching those communities. We also do a lot of surveillance activities, integrated supportive supervision. My colleague will talk about that, auto-visual detection and reporting for AVADA. This is a solution that was deployed to strengthen community-based surveillance to complement the traditional surveillance system, especially in areas where the traditional surveillance is considered to be weak. Again, environmental surveillance, supporting the regional office in terms of monitoring the environment for any the presence of polio virus is critical. We also deploy solutions that will support the monitoring of those activities around that. Again, rapid response is one of the key activities for the polio program. As some of you might be aware, there has been the program put in place what we call the RRT, the Rapid Response Team, based at the regional office, which work very closely in collaboration with all stakeholders at the country level. So the GIS Center has put in place several innovations to support from planning to implementation, as well as post-implementation activities to see the quality of the polio campaigns, as well as other activities. On top of all this, we want to ensure we sustain the use of these solutions at country level, and capacity building is one of the key programs of the Afro GIS Center. So the rest of the slides, I'll move fast because they are visual. Baseline map production, this is an example. So this is based on the data that we've been collecting over time through one of our solutions called the Integrated Supported Supervision, as well as electronic surveillance. We are also building what we call master list of health facilities for the region. This is just an example of the work we are doing for Congo. Again, more accuracy in microplanning. When we started this process, we realized a number of countries were using paper-based maps for microplanning. And I'm sure you would agree with us that it would be very much impossible to put all the settlements, points of interest, and everything that you need on a microplan on a piece of paper and given to vaccination teams to delineate their team areas and then reach those communities. So what we did, we developed GIS-based microplans, and then we asked the world focal persons to delineate their traditional team areas. And as you can see, a lot of these areas were missed in their microplans based on what they used to put on the paper maps. And then we came up with digitizing those team areas, providing 11 teams in this particular part of the region. This is a map for one of the countries, Nigeria, specifically around Kano State. And then to make sure that the team distribution is rational and teams can cover optimally the areas assigned to them. And of course, you will hear the polio program emphasizing every last child, regardless of where the child lives. It is the priority of the program to ensure that they reach all areas assigned to the vaccination teams. Again, we realize over time that yes, you might come up with a very good microplan, you might delineate your team areas, you might assign teams with their supervisors to reach all the settlements, but you are not in control of whether these vaccination teams are reaching the areas assigned to them. As a result, we came up with another innovative solution, that is to be able to track their movement. This solution just shows the tracks of the vaccination teams as they move around. And when we started this innovation, we realized in one of the areas that it was deployed, we see initially a lot of tracks under a mango tree, for instance. So we realized that some of these vaccinators might just go and sit down thinking that we will not know where they are covering. So we can download this information and then analyze it in such a way that you would see where they are reaching in terms of the settlements that they are supposed to cover. For instance, this is an example of one of the areas. For days 1 to 4, we guide the monitoring of the activities. For instance, these yellow dots are vaccination days 1 to 4. And then at the end of day 4, we download what we call the mis-settlement report. And we also know through this platform, the geographic coverage. And it's always important to emphasize that when we say a high percentage in terms of coverage does not mean these kids have received the vaccines. But of course, we provide these solutions as an incentive to ensure vaccination teams are reaching the settlements that are assigned to them. Again, in mop-up, during mop-up activities for day 5, we don't want them to wander around in the same areas. We want to show them which places they are missed critically so that they can go and immunize the children in those areas. Again, after we've successfully implemented this in Nigeria, as most of you know, at the time, the focus of the program was to ensure that Nigeria is removed from the endemic list of countries in terms of polio. So now at the regional office, we have transitioned this to what we call a geospatial tracking system, where we can deploy this across the region based on the needs. And then currently, what we do is we support the rapid response team when they implement a vaccination program and identify provinces or districts where coverage is very poor. They will reach out to the GIS center to say there is a need for us to track vaccination team activities in this particular ward, in this particular district, based on the outcome of the round. So we target areas that are critical in terms of improving quality. Again, moving forward, Again, this is also very similar to the discussions that we are having here. So there is a platform that we've also developed based on the rapid population estimate. And then we glean that data together through this GeoPod platform, which for us, based on what we are discussing here, is a potential microplanning solution for HPV. Again, you can identify where are the points of interest, where are the schools, and you can see the distribution of schools. And you would probably be able to target your interventions more appropriately. This is just an example to show that you can identify a particular school and say, let's see the number of people living within 1 kilometer or 500 meters of a particular school, and it can give you that estimate. So interactively, you could do your micro planning, you could do your field planning activities at different levels. This is just another example solution that we use. Again, as I talked about the Avada solution, mainly used for community-based surveillance for acid flaccid paralysis, AFP cases. Monitoring at the community level, we have over 9,000 community informants that were used in terms of monitoring those communities for any case of AFP in 11 priority countries where these have been deployed. So I would stop here and give my colleague Mari the opportunity to share with you some of the potential local solutions that we are using and that could also be leveraged by other programs in terms of data collection as well as monitoring. Thank you very much. Over to you, Mari.
Thank you. Thank you, Touray, for that enlightenment. May I call upon Mary Emmy Babona, also from the WHO Regional Office for Africa. She's a GIS consultant with a master's degree in GIS for environment and sustainable development with an ongoing master's in public health. Over to you. Thank you.
Thanks a lot, Madam Chair. Thanks a lot, Sir Kebba. So I'm going to talk a little bit about the potential local solution under the Afro-GIS Center. So the main potential local solution has been the mechanism to introduce the mobile data collection and also monitoring. So as actually the certification, the Polio certification became palpable, one of the dire and important desire was to have a kind of decision, a kind of evidence-based and systematic surveillance. And for that, the GIS part or the geolocation part of it become very important. So the integrated supportive supervision, which is a data collection checklist used for surveillance, active case search, and also routine immunization, came on board, which is mainly administered by WHO and the Ministry of Health at the lowest level, came on board and then help also to have this evidence-based, because it's not a checklist only questions. It also gives a kind of accountability of where the surveillance personnel went and what they have done. So the ISS is made of two important components. The first component is about active search case for AFP. And the second most important, also important, is routine immunization. So how actually the routine immunization is done, or the surveillance or the visit are done, they're done at priority level. So the country actually put all the facilities and actually highlight them onto priority level. So we have highest priority level where we have like refugee camp, and high priority level, then we also have them into medium and low priority level. So all of them, the whole idea is to have surveillance going to the field with a mobile application. The way you have WhatsApp, Facebook on your mobile phone, then we go to the field and do a kind of surveillance where we have in real time those information and knowing where they are going. This is an example of the regional dashboards on routine immunization from 2018 to 2021. So this will give reports on our sessions, conducted session, planned session, interrupted session, for routine immunization, giving the status of a refrigerator and stock out. And also, this to highlight that from the starting of this ISS, we started with few countries at the beginning, but now we have into the 47 Afro countries. We have 45 countries reporting on this system. And for now, we are waiting for Cabo Verde and Algeria, but it's ongoing. We are hopefully going to implement this year. So some discussions are ongoing. So another thing that we knew is that polio will not end if we don't actually, if everywhere has not ended it. That's why I'm coming to the GIS part again. So to say we always talk about GIS, for those who doesn't know, GIS is the Geographic Information System. It's all the data based on the geolocation. So we came to realize that having a report of countries saying that the surveillance is ongoing, at country level, the indicators will show that, yes, the surveillance is going. But when we analyze the data at district level, right, we analyze the data at provincial level or at health facility level, we see another picture. So you can see on the map that you have green area, right? This is actually a district surveillance map, but you also have a red area. The red area will show that the year of 2021, where surveillance were not done. So by example, a country, we have a district or a district or province, which is green, where surveillance is ongoing, and they have actually doing a lot of visits. However, when you see on the map, you will see that some districts are completely silent. So one of our mandates also is to highlight and help decision makers to know where actually they need to put their efforts. On this map, by example, we were able to talk to the country, and countries were able to make and reinforce surveillance on the area or the important areas. So apart from the local kind of data collection, we also have different innovation provided. This will be like not only on data collection, because this is a centralized, the data collection is done on a centralized server at Afro, which is managed by the Afro GIS Center, and we make sure that all the data are secured and country have the ownership of all the platform. So another initiative that came also we support sharing information is very important, it's key. Having access to the data in kind of real time where anyone in the organization can have access was also very important for us during the outbreak for polio. So we found that we were sharing, the polio were sharing many information about the campaign, the calendar. It could be when the campaign is going to go, the planned campaigns would be like the data, ongoing data for SIA campaigns. I'm going to give credit to Sarah because she actually at that time was in polio and come up with the concept of having all the magnificent tools we were doing in only one platform. This is also very important, and because it was a really game changer. So having the number of viruses, having when the campaigns are going to ongoing campaign, completed campaigns, having also the possibility to see when countries are doing SIA campaign in real time every day, anyone were able to see how is ongoing, how many settlements have been visited, and also to see the results was important. Not on that, we have also the vaccine management information on only one platform. So this was a very important and still is being used. We have more than now 100 actually visitors from the WHO, government, and partners having eyes on this. So another thing was also like the support, leveraging the polio platform for COVID-19. So when COVID-19 came, countries came to us saying like, what should we do for contact tracing? What should we do for case investigation? So we really use the platform to support the country. Not only the platform, by example, the ISS, Integrated Supportive Supervision, which started with only electronic surveillance and routine immunization, now has become to have other components like health resilience and the COVID-19 questionnaire, which help the country. When the surveillance are going to the field, they were also able to report COVID-19 parameters. So we have also the service continuity. We also supported the
Une activité de continuité, nous soutenons.
Sorry? Okay. Sorry. Okay, thank you. So we also came to have like the COVID-19 also IHR measure, which is ongoing. So from that, we don't work alone. Sorry. We don't work alone. We really have different partners and stakeholders which support in data analysis. We work closely with WHO HQ, with the MOH, because most of the data manager, we are in a close collaboration with them. We also have a big GIS focal points at country level, which help us to make this possible. We also work with Bill and Melinda Gates, UNICEF, CDC, and different vendors like Grade 3 Novelty. So from that, I will say asanteni for this opportunity and for your time. Thank you so much.